In 1980, the program at NAIT was called Respiratory Technology, and it was a 2-year program. The first year being a year of didactic, and the second clinical placement in a hospital. In my case, it was the university hospital. I had a wonderful year at NAIT. I loved the program, and the faculty was exceptional. I also had the opportunity to play basketball for the women's basketball team, the Ook Chicks, and so that was a lot of fun. I had attended post-secondary education in my hometown of Camrose at Camrose Lutheran College, and then transferred up to Edmonton to the university to complete my Bachelor of Science. After that, I worked at the Misericordia Hospital in the admitting department and had heard about respiratory technology as an emerging health field. And so I had always been interested in medical, and when I looked into the program, it was offered at NAIT. And I applied and was accepted, and the rest is history. There's been a lot of change in the industry, which is one of the things that attracted me to respiratory therapy. Certainly technology has changed. We've gone from mechanical devices to computerized devices with sophisticated monitoring systems, non-invasive methods of measuring clinical status, and electronic documentation, of course, gone nearly completely away from paper charts. The role of the RT has changed significantly, from oxygen delivery and aerosol therapy to developing care plans for extremely complex patients. We've moved from working under doctor's orders to therapist-driven protocols and practice guidelines. There's been a broadening of the areas that you will see RTs working. They now work in the OR, in community, pulmonary diagnostics, home care, sales, research. And you're now starting to see RTs work in senior leadership positions. As a young RT, I quickly developed a passion for critical care, and a position opened up in the critical care unit as supervisor, and the manager at the time gave me that opportunity, one of many opportunities I was given in my career. Working in critical care was super intense. I really loved the multidisciplinary environment, working as a team to deliver the care to very sick, complex patients and see them recover. It was very rewarding. As a supervisor, in addition to the clinical work, I also had input into policy and procedure development, trialing of new medical equipment and therapies, mentoring, coaching staff, teaching students. I had some research opportunities and was able to do a little bit of traveling. I think the most exciting thing was looking for ways to advance the role of the respiratory therapist so that we could be a valued, recognized member of the healthcare team. The many years I spent as supervisor in the unit gave me a taste for leadership, and soon after that I was hired into various manager positions, managing the RT department and the critical care burn unit, and then went on to take a senior leadership position before retiring in 2020. Without a doubt, this has been the most challenging time in my career and in the career of most healthcare workers. Workload and volume of patients has certainly been a challenge, and staff have been working very hard on the front line to take care of all the patients that have come through the system. Certainly, staffing has also contributed to the challenge that we're seeing, which means that staff have been working harder than ever. And I think the one thing that has happened because of that is that staff are working together as a team. I think this has strengthened relationships between healthcare providers, and I think they certainly need to be commended for their work. I know I'm very grateful for that work. Providing students with quality placements has also been another challenge in the pandemic, because it's important, of course, to keep them safe and yet give them the experiences that they need. Because of COVID and the role that RTs have played in the care of the patients, the profile has been raised, and I think the general public now understands what an RT does at the bedside. I think it's been good for the profession, and I think that generally speaking, most RTs feel recognized and valued for the work that they do. I've had an amazing, wonderful career. I'm extremely proud to be a respiratory therapist. I've had the opportunity to work with many incredible professionals, and been given many opportunities throughout my career to do a number of different things. was my intent to move into some volunteer work after retirement, but was pulled back into the COVID response at the University Hospital in the Site Command Post. This has been so completely unexpected. It's been such a great honor to be recognized by my peers and colleagues. There were many people who supported me along the way, most importantly my family, but I also worked with a number of professionals who were amazing and helped me succeed in what I did. I'm so very thankful to Nate and the board for honoring me with this award. It means a great deal.